But my question, I do not have a blog. My daughter last night said, stop saying blog, just keep saying blog, and you'll know how to pronounce it. So I'm here learning, and it's a wonderful experience. This is a great group of women. But I'm really interested in elder care issues. So many of us are caught right in the middle in the sandwich generation. So speak to us about that, please.
I face this issue myself. 87-year-old father who had a stroke in 1990. He's a kind of stroke where he has aphasia, so he doesn't speak much, and now he's gotten exceedingly grumpy in addition. It's still a pleasure for me to see him, but honestly, dealing with his issues is enormously time-consuming. And so what we've done, because we're in an economic position to do it, my mother used to be able to care for him, but she has dementia, she's 84, and so we've hired, because I'm not there in North Carolina where they are so much, but in places like this, we've hired senior management company to take care of one woman who takes care, basically has my role, because we have, the financial wherewithal to do it. We need, just as we need to expand the number of people in early education, we also need to expand the number of people. Excuse me. I should cover this. But
then you'll knock it off, and then we'll have to find it.
Right, that's right. We need to increase the number of people who are capable of navigating that incredibly complex system of elder care. It's not just taking care, doing the daily things that need to be done, but navigating an incredibly complex system of Medicare and supplemental insurance and the adequacy of particular facilities. And I think so much about, you're probably asking a question from your own personal experience, but what happens to my father and my mother if they had no children? And I mean, where are those people and who's taking care of them and who's watching them? It may be that we need, in those instances, to designate, we have social workers or people who have economic problems. Maybe we also need this because we don't think they can deal with the issues that they're confronted with in their daily lives. It may be that we have a whole new industry that is going to take place in this country, probably around the world, of people who are providing that kind of assistance to the elderly, both those who are blessed to have children like you and like me, and those who are not. Honestly, it's only John's healthcare policy that presently addresses that, but we know that that's an emerging problem exists today. It's likely to get worse before it gets better, and that we need to address both facilities issues and caregiver issues. Another policy, though, that is important for this is the expansion of nurse educators. Now you think, well, we need more nurses for this wide range of things, but the truth is, we're really pretty much at maximum capacity at nursing schools because we don't have enough nurse educators. Nurses have been leaving the profession in large numbers because of things like mandatory overtime and insufficient pay, and we need to draw them back. If we can't draw them back into nursing altogether, we need to draw them back in as nurse educators, give them an opportunity to get masters in nursing, which is what nurse educators generally have, and get them involved. Sometimes it's because they're now some become mothers and want a more regulated schedule, and we need to give them an opportunity to continue to help us with our nursing problem, especially in senior nursing.
And my question for you is this: how can we as a group, in your opinion, engage the entire society of the United States into a discussion about real issues and get down into the details of that, instead of watching their 5 minutes of Paris Hilton every day, and get
And if I may add to that, David, there was another question on the blog by Susan Getgood who asked, listen, how do we avoid just partisanship if we're talking about politics and getting to policy? So I guess we're talking about from Paris
to policy. Yeah, I wish I knew the answers to these questions. I don't entirely. And what is with Google not having that on why does it have to be a pull down to get the blog? I made it, you know, I've made, not only do I have blogs, but I have blog search engines as a favorites as well, so it makes it easier for me to get to. You know, I probably, some of these places, I guess it's a matter of demand, you know, and so, you know, it might be that one of the things you start on the internet is sort of this demand that blog search engines be included on their sites, you know, just by, you know, I think that they are responsive to what the actual user community wants, so it may be just a question of, I'll be happy to sign up, I'll sign whatever email petitions you have going on this, and that may be one of the solutions. As for, you know, this is part of the conversation that we're starting over here about upstate New York, when people have lives and sometimes they'll turn on what they describe as news. If they're really looking for entertainment, they're not looking for news, and they're not looking for in-depth discussion. I'd like to see, I mean, when I turn on my radio news, and I get satellite radio, I turn on the BBC News. I don't want to hear 90 seconds on an issue. I want to hear it fully discussed. And so I can, you know, when I'm in the car, I can get more on that than I'm going to get, because our media is now basically, you know, it is infotainment, and how it is you engage people on serious policy issues. The only way that I honestly know, David, to do this is to put it in personal terms for people. It's why you often hear politicians telling the story. Sometimes they're pretty lame, but you know, sometimes they can actually reach you as you tell the story. I was telling the story about the woman who whispered in my ear in Cleveland about breast cancer. I was in Cleveland giving a speech, and this quite lovely woman had obviously dressed to come to this event, but I knew from what she told me later she didn't have very much, because she leaned over to me and said, I found a lump in my breast, and I'm really afraid. And she was a tremor in her voice, and she said, I can't go to the doctor because I have no insurance. And I tell that story about people, about women, and to say, if that lump is cancer, this woman dies. It's not a question of whether she lives or whether she manages to eke through. She doesn't. She has breast cancer she's not treating. It's going to spread, and she will die because she doesn't have insurance. John tells a story about the man, you talk about health insurance, the man in West Virginia he met. I think he was actually in Wise, Virginia, but the fellow lived in West Virginia. John met him, he was older, but he was robust, but he talked kind of awkwardly, but he said that actually he had had a cleft palate as a child and was unable to speak. He could speak, but he couldn't be understood. And finally he got it fixed. And he could be understood. It was still difficult, but he could be understood. And here in this country, he was 51 years old when John met him. He got it fixed at a free clinic when he was 50. For 50 years in America, he couldn't be understood because it was a $3,000 operation, the country of this wealth. And we allow these to happen. And I think that maybe some of these policy discussions need to happen in the context of the human stories, which actually empowers each of you. Because what sort of the genius behind blogs is that it gives people a venue to tell their personal stories. So when you have a policy about something, you can invite, you know, either you can tell your stories or the stories you know, or you can invite people to tell their personal stories. I actually think that's the genius behind YouTube. You know, it invites people, you know, to make idiots of themselves if they choose. There's plenty of that, but also to tell whatever their personal story is in a way. We feel, just as young people don't feel their voices are heard, I think people dye their hair purple because they want to be noticed in a very crowded world. And we just need to give people a chance to speak and be heard.